Hi, this is Elsie Kearns, wellness educator, and I am holding Christiana Northrop's new book, Goddesses Never Age. And I have the pleasure of interviewing Dr. Philip Getson and Leisha Getson today. We're going to talk about their meeting with her and also thermographic diagnostic imaging. So, Philip, welcome.
Well, good afternoon, Elsie, and thank you very much for this opportunity.
Yes, I understand you met Christina, and she has actually endorsed your work.
We did. Actually, what happened that preceded that was that she had contacted me by email asking whether or not I would be a guest on her Hay House radio show. As you know, Christine Northrop is a very big advocate of thermography. She states that she's never had a mammogram, never would, and she gets routine thermograms for her breast screening. And so I had done 2 shows with her on her Hay House radio before we ever met. And then 2 years ago, we were at the same conference in Chicago where she was the last speaker. She was the keynote speaker in front of almost 800 people.
Wow.
Prior to the lecture, which was called What Women Want, we managed to introduce ourselves to her, and she was as delighted as we were to meet. We spent some time in the green room with her, getting to know one another, taking pictures and exchanging information. And then when she gave the lecture, a few minutes into the lecture, she began talking about screening and talking about thermography, and was kind enough to mention that Leisha and I were sitting there on the front row and identified us as expert and world-renowned thermographers. And it was a great honor for us to meet her, and an even greater honor to be recognized that way in front of this group of people.
If I might,
Wow, that is
something, Elsie.
Go ahead, Leisha.
My good friend Phil is sitting in the front row, and then she proceeded to say, you know, that he was a thermographer and has been doing it for 30 years. But she introduced him as her good friend Phil Getson. So it was really neat.
Wow, what a wonderful tribute. And Philip, I understand that many countries in Europe are endorsing thermography, actually shutting down mammogram centers. Is this true?
Are they shutting down mammogram centers?
I'm sorry, I didn't hear the question. Thank you. What's happened is that the country of Switzerland in 2014 passed a law on a recommendation from the Medical Society of Switzerland to state that they could no longer open new mammography centers. The existing ones were permitted to continue, but they banned any future mammography centers, with the understanding that the further recommendation was for them to close all the mammography centers in Switzerland. Now, to the best of my knowledge, that has not yet happened, and it's still in the works. But I think they were really the first company to come to the country to come to the complete realization that the test known as mammography probably has more of a downside than the benefits it provides. Other European countries have moved thermography to the forefront. Germany, Poland, Italy, where the Prime Minister actually signed a law into effect validating thermography for breast screening. And outside of Europe, Japan, and in South America, Brazil, where thermography cameras actually appear in emergency rooms for general health screening purposes. So we're a little bit behind the times in terms of moving it to the forefront of medicine, but we're getting there.
Great. So, Leisha, let me ask you, can you explain to our audience the difference between a mammogram and a thermography? Because I understand you actually do that for the women that come in for breast screening.
Sure, yeah. Well, the main difference is a mammogram is an anatomic study. They are using compression and radiation. The compression is the equivalent of 50 pounds of weight on the tender breast tissue. So compressed with 50 pounds of weight, and that now traumatized tissue is shot with radiation. Now, all of the women are told it's not a lot of radiation. It's about the same amount of radiation you get in the airport. That's not necessarily true. It may be the same amount of radiation, but it's now on a compressed breast that's been traumatized, and it's in a very focused laser-like way going into the breast tissue. So it's not like the whole body can handle that. It's going right into the breast tissue. So with thermography, there is no compression, there is no radiation. It's a physiologic study, so we're looking at the physiology or the function of the breast. Because it's a physiologic study, we have the potential to find problems 7 to 10 years before an anatomic study. That gives women a very large window of opportunity that if there are any thermographic abnormalities, to do something proactive. And we have seen, you know, through dietary or lifestyle changes, hormone balancing, even something as simple as getting rid of an underwire bra makes a big difference. And we've seen those differences, and we've been able to document them with thermograms, say, you know, in a 3-month period of time to see those changes happening.
Well, one other important thing, Leisha, is that I understand that when you do the thermography, it also shows the lymph nodes, which it does not do in a mammogram.
That's correct, Elsie. So when the woman is doing the thermogram, they're standing in front of the thermographic camera. They're standing with their arms resting on top of their head or their hands resting on top of their head. So we're looking at not only the breasts from every angle, but we're also, as you stated, looking up into the underarms, looking at that whole lymph section. You know, this is all of our lymph section, which we need to push out toxins, and it needs to be working properly. That's why we encourage not wearing underwire bras and not wearing antiperspirant, so that the lymph system can do what it needs to do.
Well, I do realize lately from some of the new information that's come out that whether women realize it or not, that underwire bra is nickel, and many people are allergic to nickel as a metal. So even if they have to wear an underwire bra, it should at least be plastic. But there are a lot of underwire bras out there that do not have the metal in them now.
That's correct, yeah. That wire, in addition to compressing the breast in a dangerous way, it also attracts EMF. So, you know, with all of the EMF pollution that we have going on, you're getting zapped constantly if you have an underwire bra. So I encourage women, you know, because they like their bras, the bras are expensive, to maybe just pull that underwire out, or as you stated, maybe get the one, if they feel like they need some support, get the one with the plastic wires. But not to wear it 24/7. You know, take it off as soon as you get home from work.
Right. Well, Philip, going back to you, I understand that you took this concept of allowing thermography to be a diagnostic tool approved by the insurance companies all the way up to the Supreme Court. I think you sued them so it could be validated as a diagnostic tool.
That's correct, Elsie. I started doing thermography in 1982. And at that time, I really believed that it was the next great test for the purposes of diagnosis and neuromuscular issues, which is where we started back in 1982. The insurance industry, Allstate and State Farm specifically, decided that they weren't going to pay us for the diagnostic test. So in 1983 or 84, we actually sued them to try and get them to pay for thermography for neuromuscular applications. And they, of course, didn't pay us, and we went to a trial that occurred in Camden County, and the trial lasted for almost 8 weeks. We were in court almost every day for 8 weeks in front of a judge, Allstate bringing in their witnesses and State Farm bringing in their witnesses, because we sued both Allstate, State Farm, and also the state of New Jersey. And as such, the trial, after 8 weeks, there was a deliberation time, and the judge ruled that we had won, that we had, by a preponderance of evidence, proven our point that it was a valid diagnostic tool. And Allstate and State Farm appealed, and that took another 1.5 years, and it went to the appellate division, where again we won and they lost, and so they appealed again, and this time it went to the Supreme Court of the state of New Jersey. Now, by this time, they had realized that they'd lost at 2 levels, so they fired the counsel from New Jersey. They brought in their big guns, so to speak, their House counsel from Indiana and Illinois, where the main offices are. And here we are in the Supreme Court. My friend, the lawyer, who had a wonderful attachment to his law school briefcase, so he was carrying this 25-year-old briefcase. I'm there in an off-the-rack suit. He's there in an off-the-rack suit. Allstate brings in 3 lawyers with $5,000 suits and these $500 briefcases. State Farm brings in 3 lawyers with $10,000 suits and $500 briefcases. And the Supremes walked in, all 5 of them. I always say they walked in without Diana Ross. So these 5 very regal men in their long gowns and robes walked in, and Allstate's lead lawyer got up and he buttoned his expensive suit and he flashed his cuffs and he cleared his throat. And before he ever got a word out, the lead Supreme said, "Sit down." And he pointed to us and he said, "They win, you lose, you pay them." And I always said I wish there was YouTube back in those days, because if I had had a camera to take a picture of the look on their face, they never got a chance to say a word. And so this is the only state in the 50 United States where there's a Supreme Court verdict that says that you have to pay for thermography as a valid diagnostic tool. And it has been a case that has been used throughout the nation as a basis for lawsuits against the insurance industry to validate the use of thermography. So we're very proud of that. It took almost 10 years to get from point A to point B, but looking back on it, it was a wonderful, if not exhausting, experience.
Yes, exhausting is right. Can you clarify for us, if somebody comes in for thermography for the breast, for example, because I know you do other things, thyroid, dental, you also work with RSD clients. What does the insurance company cover now?
Well, in a neuromuscular case, in an RSD case, we'll get it pre-certified and they will pay for the thermogram.
Okay.
In a breast case, we don't participate with insurance, so we ask for payment at the time of the examination. The fee is $300 for a breast study. That includes the images that the patients get. We send them a copy of the actual images. We send them a copy of the report. And we make me available after hours to discuss with them the findings of the breast thermogram so that they can understand exactly what it is that they're looking at and understand what it means. Because for someone that's never seen it, it can be a little confusing, but it's really very simple once it's explained. And that gives women a chance to be a part of the process of their own health concern. I think it's really very important that a woman understands what she's looking at so that she can look at it down the line and she can understand what she's going to do in terms of getting her breast or her whole body healthier. A thyroid dental study is $125. There's a $25 break. It's $100 if it's coupled with one of the other examinations, and that images the face and the thyroid gland. We started out doing thyroid studies alone, and after a while we came to the understanding that there was so much infection and inflammation in the dental area that was causing not only thyroid malfunction, but reflexing down and affecting breast tissue, that we began to incorporate the face and the sinuses. So a thyroid dental study looks at the sinuses, the dental regions, and the thyroid region. And again, it's the images, it's the opportunity to discuss the images, and it's also the opportunity to have those reports sent out to a healthcare practitioner or practitioners of their choosing. And that's all included in the fee that I just gave you. For the most part, the insurance industry has slowly but surely begun to understand the value of thermography. At this point, about a third of people are getting reimbursed a portion of the fee that we just talked about. And every year that number seems to increase.
Well, I know that I've had it done, and what I loved was not only your personal letter, but receiving all of the photos in color showing exactly what was what, and then your explanation and targeting an area that you felt, you know, might need more viewing or more follow-up.
Well, we look at this as a screening tool, And as such, as with any other screening tool, it's something that we feel should be done first. And then you can move on if necessary and do other things. A breast self-exam and a clinician exam is very important, of course, and should be done regularly. We recommend ultrasounds for identifiable areas. We recommend MRIs for larger problems, and we will help the patients as necessary to make sure that they can get those tests done at the facilities that perform them. And then we integrate the information so that they have, when necessary, an anatomic study to correlate with the screening thermogram.
Well, that sounds great. A really comprehensive look at what they need to understand. And Alicia, I'm not sure what the current statistics are right now, but breast cancer seems to be on the rise. There's so much fear around all of this. Do you have any comments on that?
I do, Elsie. I think the numbers are 1 in 7 right now, but the whole fear factor in the cancer industry, and I say industry because it is just that, it's an industry, so you have to keep that in mind. I really feel like the fear factor is used to coerce women into doing things that aren't necessarily good for them. So they scare the heck out of them to get the mammograms. The hereditary thing is overplayed. That only plays about a 4% role. But you hear, if a woman's mother has breast cancer or the grandmother had cancer, they're so scared to death that they're going to get it that thought is constantly in the back of their mind. And I wonder, as we know as energy practitioners, that plays a large part in what's going to happen in the woman's body. If they're constantly thinking about it and focusing on it and afraid of it, well, then we know what happens. But the way that women are coerced into getting mammograms, if anything is seen, and there are 800,000 unnecessary biopsies done a year in this country based on false mammographic readings. Those poor women are scared. They're rushed through the process. They get the mammogram, and before they even know what's happening, they're in for the biopsy, and it's just a whirlwind. Before they can stop, take a deep breath, think about what they're doing, look at other options. They are really just herded and pushed and coerced into doing things that are probably not in their best interest.
Yeah, there's a little bit of overkill on all of this. So, Philip, how can people get in touch with you and Alicia? I know you have a PowerPoint slide, and I do too, whichever one of us would like to bring it up, because it has all that information about your work and where to touch base with you.
I brought it up, Elsie. Can you see it on your end there?
No, not yet. Let me see if I can bring it over.
Okay.
Okay, and I'll share that. There we go. Great. So everyone, here is how you can get in touch with Dr. Getson and Alicia at Thermographic Diagnostic Imaging, their website, their phone number. And I want to again comment on the fact that Dr. Getson is the leading expert in the country on thermography. And of course, Alicia is a board certified thermographic technician and also a holistic health counselor. And of course, I'm just a moderator here, but this is helpful. But I love educating people about these things that we can have access to that are really 21st century information. So we're going to have that available to you to look at. And I want to thank Dr. Getson and Alicia for being with us and sharing all this information about thermography and the different ways that they use it, and particularly for breast screening. So thank you again for taking time out of your day. It was great to be with you, as always.
Thank you so much, Elsie, for the opportunity.
Thank you very much.
Okay.
All right. Bye-bye.
Bye.